Welcome to the UT Southwestern Radiation Oncology Residency Program. Truly, this is one of the most exciting programs in the country with abundant advanced technologies and diverse faculty members. When you finish training here in 4 years, you'll be most highly trained physicians, not as a skilled physician, but as compassionate physicians.
Today in this video, we're going to try to give you a little bit of a flavor of what we have to offer here at the UT Southwestern Radiation Oncology program and what in particular sets us apart.
At UT Southwestern, our Radiation Oncology Residency program is on the large end. We have 14 students, so it's anywhere from 3 to 4 a year. The general structure is that the first 2 years you're doing clinical rotations. Then the third year you get an entire year for research or whatever other academic interest you have. Then your final chief year you come back and do clinical rotations. This is a very exciting time to be at UT Southwestern, especially in radiation oncology. The building that this is being recorded in right now is only a few years old, and we already have a new building that's being built just across the street that's the same size. And so I think that's a testament just to how much the program is thriving.
Now, why is this so exciting and why is this so awesome? And the answer is because that building is going to be called an adaptive radiation therapy building. This is what I call the mother of visualization during delivery. Everything can be actually adapted and morphed to actually match the patient's system right now when the beam is on. If you join our department, you will be exposed to 7+1 gamma pod machine here in this environment, in this department, and in about a year, 6 adaptive radiation therapy machines that are coming in the new expansion in the new building. Altogether, that will be at least 14 to 15 absolutely top-notch technology machines that exist in the radiation oncology world. Not that many centers in the world can say that.
Technically, we have probably the most diverse treatment options available in the country, ranging from every single possible means of delivering stereotactic radiation therapy, both intracranial and extracranially, an incredibly diverse array of brachytherapy options, as well as intraoperative radiation therapy. And also we train people in a range of procedures as well that help to complement and reinforce the clinical role that we have as physicians.
Regardless of where you get a job, whether it's an underserved community or a more affluent community, if they have a SABER knife or a gamma knife, you'll be well equipped to handle any of those situations. So when it comes to the next step in your life, you will be very marketable.
We offer a truly comprehensive clinical education program here. Residents who graduate from our program can effectively do and treat any disease site, ranging from benign disease to the most aggressive malignancies.
The didactics on average are about 4 to 5 hours a week. Usually it's 1-hour lectures over 3 to 4 days. 2 to 3 days a week are clinical lectures. We'll show a real patient case, go through the images, the workup, and then we'll review the literature and management. In addition to that, we have a physics and a rad bio curriculum that are both very strong.
Residents in our program will generally go through 3-month-long rotations. On those rotations, you will work with specialized attendings that are generally focused on 1 or 2 disease sites. You'll really get to experience the comprehensive management of the disease. You'll work closely with practitioners from other specialties. We have very focused disease site tumor boards that provide contributions and input from the entire range of physicians that are focused on that area. Residents are trained thoroughly in SABER knife and gamma knife. They are able to manage basically SBRT in any intracranial, extracranial site. They also get an incredibly comprehensive training in brachytherapy. The residents, in addition to all of their direct clinical education and training, also get to participate in a number of technical training courses. We offer an SBRT course here under Dr. Timmerman.
One thing we do here is called total body irradiation, but we do it a little different than other places. We use a VMAT technique, which is volumetric modulated arc therapy. It's something that was kind of invented in-house.
Our residents gain experience in intraoperative radiation therapy for some of the most advanced malignancies in the pelvis, abdomen, or thorax. We also train our residents in a range of procedures that complement their clinical practice. Another resource that is also available for our residents is the gamma pod breast SRS system.
One of the things we love here is that we have a great affiliation with the Children's Hospital. We have multiple children's tumor boards that we go to every week, and we see a good amount of pediatric patients that we treat here. And we also share some patients with the Proton Center, and there's actually opportunities to rotate there as well if interested.
In addition to the medical residency, we also have one of the country's largest physics residency programs. We have a graduate training program, as well as programs in radiation biology. This network of training opportunities also helps to enrich the medical residency program because of collaborations for both research and education that just naturally and organically develop through that. UT Southwestern is a NCI-designated comprehensive cancer center. Our residents are all candidates for trainee membership in the Cancer Center and can then become involved in different cancer tracks, which can include population science or experimental therapeutics. One mechanism that offers a great opportunity for collaboration is the Medical Artificial Intelligence and Automation Laboratory, or the MAIA Laboratory, under Dr. Steve Jang. A number of our physics residents and medical residents have been working together on forward-thinking, artificial intelligence-based solutions to problems that we face in the clinic, as well as problems that we face in terms of radiologic interpretation, treatment planning, and treatment delivery. Research is an integral component of the radiation oncology residency here at UT Southwestern. For all residents, we have a year of protected time for research, which can be laboratory focused, it can be physics focused, it can be clinical research focused. Some of our residents have chosen to pursue professional degrees or international research. Residents get involved in research, often through exposure, with their clinical attendings, all of whom are closely involved in academic research and involved with collaborative trials. And some residents choose to pursue a longer course of research through the Holman pathway. One nice benefit about this program is that we have an internal grant program of up to $15,000 to basically be a seed grant for projects that are led by residents. A great new resource that we have available here is our Simulation Center, which is a multi-floor, comprehensive surgical and procedural training facility. This helps to get residents off and running. They're able to perform some of the basic techniques before they ever hit the operating room. Throughout the rest of this video, we're going to be telling you a little bit more about what really makes this program unique. You'll hear from our program leadership, who are truly national and international thought leaders in cancer care. And we'll be talking a lot about our program areas that we've really developed ourselves as world leaders.
Within the central nervous system team, we have multiple physicians who have extensive experience in treating all types of brain tumors, as well as spinal cord tumors in adult and pediatric patients. We have tremendous technology. This allows us to be more flexible in the treatment algorithms that we can apply to patients. We're able to treat tumors more precisely as well as more potently, while at the same time having the advantage of sparing more healthy, normal tissue. We have a comprehensive Gamma Knife program, which is a specialized machine which allows us to offer focal and precise radiation therapy within the brain. We're able to offer patients not only the best technology, but experience and expertise. Patients with brain tumors are presented at our multidisciplinary conference. No decisions are made in isolation. We're all going to choose a treatment which is best for that patient's care. We have extensive support staff within physics, radiation biology, as well as therapists who all focus and have significant experience in the treatment of brain tumors.
The primary role of physics is to facilitate patient treatments. We perform machine quality assurance tests. The secondary goal is every time that we have patient treatments, make sure that the treatments are done smoothly. It's not only enough to have the knowledge and drive and desire to do something, it's also the tools that allow that happens. And in our department, we do strive to always have the latest technology and implement that in clinical practice as soon as possible.
We also have courses where we're training physicians and practitioners around the world. Really, what is uncommon in other facilities is found to be very common in our practice. Like anything in medicine, having extensive experience is going to drive not only the practitioner's abilities, but also patient outcomes. We see everything, we see a lot of everything, and we do it well.
UT Southwestern has technologies that are unmatched anywhere in the world. Importantly though, UT Southwestern has the people that are motivated to do the best they possibly can with this technology. We always are trying to push the envelope. This involves clinical trials, it involves collaboration with a host of scientists at UT Southwestern. Traditional radiation was given almost like a bath of radiation. Stereotactic radiation is almost the polar opposite. We use technology to precisely treat an area. This treatment is incredibly effective against metastasis. This SABER treatment is actually increasing the length that people live, and some people are actually cured even with previously uncurable cancers. This is the treatment paradigm shifting approach that SABER and stereotactic treatments like radiosurgery have enabled. Hypofractionated treatments. Hypofractionated means few treatments. We did the clinical trials that showed the efficacy of this. Patients get a treatment that's highly focused. It's not just convenient, it's more effective. We partner with the more modern systemic treatments. Immunotherapy or chemotherapy with SABER is better than either one by itself. We're trying hard to get other centers to practice the way that we practice. We've trained hundreds of physicians, physicists, and therapy personnel across the world. We want patients to know that our main priority is their comfort, their care, and to try to cure them and make sure that their needs are being met.
At UT Southwestern, we specialize in delivering cutting-edge treatments and radiation for breast cancer. Patients are going to be getting a multidisciplinary treatment with world-renowned research. We specialize in stereotactic partial breast irradiation. We are minimizing the number of treatments, and we're also minimizing the amount of tissue that is being irradiated, such as the lungs and the heart. We have a cardiac sparing program to further reduce any potential side effects to the heart. We have 2 machines that we can offer these treatments on. The SABER knife that can track the patient's breathing during treatment to help us minimize the amount of tissue that we're irradiating. The other machine is called the Gamma Pod. We are the second institution to have the Gamma Pod in the world. We are able to immobilize the breast to try to minimize the amount of tissue that we're irradiating. We're one of the first institutions to offer extremely short courses of radiation, what we call hypofractionation. One of the main benefits is the convenience for the patient so that people can get back to their normal activity on a daily basis. We are also involved with translational research that may further improve the outcomes of our patients. We want people to come here and feel that they matter and that their team members are caring for them so that they can get through these really difficult times in their life. That's what keeps all of us doing what we're doing, and we hope to offer that type of care to every person that comes here.
Brachytherapy is a very complex form of treatment that can be applied to basically any disease site in any part of the body. It allows the placement of a highly active radioactive source directly within or next to the tumor that we're trying to treat, while sparing other organs. It's one of the best ways of obtaining a cure while minimizing the doses going to the rest of your body. One of the things that truly sets us apart, we have the greatest range of brachytherapy treatments available in Texas. We're able to offer intraoperative radiation therapy, endoluminal brachytherapy, both low and high dose brachytherapy for prostate cancer. With high dose rate brachytherapy, the entirety of the radiation treatment is performed while the patient is asleep in the operating room. When they wake up, their treatment is complete. We have a huge team of experts who understand how to apply brachytherapy to specific disease. We can treat the entire range of gynecologic malignancies, endometrial cancer, cervical cancer. We can treat ocular malignancies, gastrointestinal malignancies. We can treat in the palliative setting. We have a multidisciplinary team for management of primary and metastatic cancers to the liver. Our goal here at UT Southwestern is to deliver the best, safest, and most effective therapy for patients. We will make sure that they get the most effective and most potent treatment possible.
We are at the forefront of applying modern technology in the use of radiation for the management of all our cancer patients. We have one of the largest clinical trial portfolios of any radiation oncology department worldwide. What we're trying to do here in radiation oncology and in the clinical research portfolio is to improve outcomes by leaps and bounds. Two of the most important techniques that have utilized the most up-to-date technology are what we call stereotactic body radiation therapy to deliver high doses of radiation to very small areas of disease, and the hypofractionation. We developed technologies that would allow us to treat the patients in far fewer treatments, but be as or more effective. We've pioneered those techniques. Our philosophy is not to ask small questions, it's to ask very big questions in the hopes of having the greatest impact. We are very proactive in ensuring that any patient that's potentially eligible for any of our clinical trials are shown the information with respect to those clinical trials, because if there's any great results, it may impact many future generations of their own families. Every patient we view as a very important member of our family, whether you receive our standard of care approach versus a treatment that may be equal to or better than the current standard of care. You may be part of a study that may establish a new type of treatment that will optimize your survival as well as your quality of life.
My favorite part about working at UT Southwestern, I think really is the culture and the people. Being around upbeat, friendly personalities, having fun in the work environment. That's one of my favorite parts about UT Southwestern.
One of the nice things about working here is the really close collaborative environment that we have. My office is down on the tube, which is basically a large office space that extends the entire length of the building and is open from all sides so that people can interact easily and freely across all of their particular disciplines. We have this amazing common space on the third floor of our building here that's very modular. When we want to host an event, when we want to host a tumor board or a large research collaborative meeting, people want to come to our department to see what we have to offer and to be able to share in the common space that we've created.
One of my favorite things about our residency program is that we have that resident room where people spend a lot of time together. All of the major learning is from each other. So the seniors teach the junior residents when it comes to patient care and the first line for answering questions. They all collaborate on research and they also, kind of collaborate on life. By the end of it, they're very good friends.
To me, the ideal resident applicant would be someone who is clearly open to learning about everything that the field has to offer. I'm looking for someone who's very curious, who's involved, invested, and who's very present in what we're doing in the clinic. And so, because we're taking care of people, their outcomes, their lives, they're important to us. And so I want someone who is clearly there in the moment and who is willing to take everything they can out of it.
It's not like there's one type of resident that we're looking for that's going to be the most successful in our program. We really try to support them in whatever avenue of research or other interests they have. And it's amazing kind of the development the residents have. So when they come here, everyone's very smart. They're just fresh out of intern year in medical school, but unsure of themselves, maybe not as confident in the interactions with patients. And you quickly see that change. And by senior year, the residents are completely independent. They could be doing everything on their own. It's more a formality that we're even here. And so it's quite remarkable to see that transformation in just a few years. It's a resident-oriented program, and that starts with the leadership of Dr. Folkert and Dr. Choi, really focusing on resident education over service, and I think that is very important. We have all the technology you could think of. We see all of the pathology in different disease sites. There's research opportunities on the basic science and translational side, as well as clinical and prospective trials. And then finally, Dallas is a great location. I think that's something that people need to consider, where you're gonna spend 4 years of your life. Dallas is a big city. There's kind of something to do for everyone, but it's still reasonable, affordable cost of living, especially on a resident budget. And I think those are all really important factors to consider.
My aspiration for my residents is that when they graduate from this program, that they are confident and equipped to basically deal with any patient diagnosis that comes in their door. In addition to that, that they're able to effectively analyze and incorporate new information as it comes up immediately and accurately, and that they're also able to contribute to the art and science of our field and to expand our frontiers in oncology. I do feel that we have set up such an environment that we can create that for our residents. They know how to use all the equipment that's out there. They are completely expert in the most cutting-edge technologies for cancer treatment. And they have seen the whole spectrum of cancer while they've been here. They've been exposed to amazing trialists, to protocol development. They've been exposed to laboratory research. They've been exposed to artificial intelligence research. They know what's out there and they know what's coming and they're ready for it.